Good afternoon, I'm Giovanni Dennis with the Midday News. A special welcome if you're joining us online at onespotmedia.com. Investigators from the Jamaica Constabulary Force have been assigned to assist health authorities at the Cornwall Regional Hospital to probe the mysterious disappearance of a vial of COVID-19 vaccine. The vial containing 10 doses of the AstraZeneca vaccine disappeared from storage a week ago. Health Minister Dr. Christopher Tufton gave an update at Sunday's COVID-19 press conference.
The management of the institution was asked to investigate. The police, I believe, has been brought in to investigate, and there have been some personnel adjustments just to ensure that it doesn't reoccur. Well, let me just say for the record that to date we have used some 22,000. 2,200 vials have been used. There is always going to be an expectation of some waste.
The minister argues that Jamaica's wastage is way below the global standard and the threshold established before the vaccination program.
There's a global standard of some 3%. We have set our target at 2%. And to date, our waste or equivalent has been 0.03%. So far less than 1%. So I think under the circumstances, I think the team in the field is doing very well. But of course, the objective is not to waste any. I think in one instance, a vial fell off a table and broke. And in another instance, someone had the vial in the hand, and I don't know what happened. And there are a few doses left in that particular vial, and it broke. So you're going to have some of these things happening, and this is a global phenomenon. But as the Prime Minister said, it is our intention to minimize this as best as possible.
Community bars and privately operated beaches and rivers are now on the government's radar for closure if COVID numbers continue to spike. Prime Minister Andrew Holness argues there is increasing non-compliance at these establishments, noting they will be closely monitored over the next 2 weeks.
We have allowed community bars to reopen, gyms, parks and zoos. How people conduct themselves in these areas are very important.
A signal to some businesses like community bars that if non-compliance and COVID cases continue to spike, their operations will be curtailed in the next raft of restrictions from the government.
Because these are areas of social gathering. For the bars, we are noticing that there is a fall off in compliance. And that is concerning. I think the protocols that we have put in were well designed, and if they are followed, we would see significant reduction. We don't want to close the bars, the community bars.
The government's hesitance to close small bars is economical. Lower income families survive from their operation. But this warning.
If other measures are required, then this is an area that will be on the list of new measures to come. So, Minister Mackenzie, ensure that you are doing your surveillance so that we can have a report within the next 2 weeks as to whether or not there is any improvement in compliance in these areas.
The same warning applies to water attractions, beaches and rivers under organized management. Public beaches and rivers are to remain closed until April 13. In the meantime, local government minister Desmond Mackenzie is concerned about the increase in the number of COVID-19 cases among young people who attend gaming lounge and arcades. Speaking at the media briefing on Sunday, Mr. Mackenzie said the government had no choice but to close these areas with immediate effect. In addition, Mr. Mackenzie says his ministry will be closely monitoring beaches and rivers to ensure compliance with the COVID-19 protocols.
We are working closely with the Ministry of Health to ensure that all the protocols that have been set out is observed during this period. Prime Minister mentioned the concerns we have about the tavern bars and the community bars, the village bars. Again, these are areas that we are monitoring, and we will continue to monitor these areas.
Special arrangements will be made for elderly people who are confined to their homes and need to be vaccinated. Chief Medical Officer Dr. Jacqueline Bisesa Mackenzie made the disclosure. Shamila Pullen reports.
As of today, people 75 years and older will be able to set appointments to receive the COVID-19 vaccine. They can do so through the Health Ministry's website, through the call center using 888-1-LOVE, and by calling their health centers or their private doctors. But for those elderly who are unable to leave their homes, Chief Medical Officer Dr. Jacqueline Bisesa Mackenzie says special arrangements have been made to facilitate them.
We had asked through the MAG for those persons to submit, the doctors, to submit the names of persons to the health departments, because we would have to make special arrangements for those persons. But we really want to see what is the distribution of those persons, to see the types of arrangements that we would have to make. But we do intend to get to those persons. Special arrangements would have to be made. Please submit your names to your private practitioner, or if it is a public health practitioner, so that the arrangements can be made.
On another vaccination issue, Dr. Bisesa Mackenzie says people who were vaccinated in another country can show their certification from that country as confirmation. However, when returning to Jamaica, those persons are still required to go into quarantine.
Right now, we don't have a large number of our population that is vaccinated. So your coming to Jamaica certainly means, if you have gone the required time, it certainly means that you are protected against getting COVID-19 if you have been exposed. However, there is still the risk that you may be able to transmit the virus if it is that you have been exposed to somebody who has the virus recently.
In addition, the CMO said not all persons will develop immunity after getting the vaccine.
We know that it is not everyone that is going to develop the immunity. So there is still a risk that exposure can lead to infection. And so therefore, the 14-day incubation period is still necessary to see if you will develop infection. So that is why it is still in place.
Shamela Pullen, TVJ News.
The announcement of early curfew hours for each of the next 3 weekends by Prime Minister Andrew Holness is receiving support from some Jamaicans. Our news team took to the streets of St. Mary this morning to hear the views of residents.
It's the best thing he could have done, because most of us not obeying the rules of the country.
They will find work for idle hands. So the less idle time we have, the more productive we can see to and from, and keep up the good work, Prime Minister.
What we are concerned about is the curfew about the parties, or is the curfew about COVID? That is what we're concerned about. We need the Prime Minister to address us. And he didn't make any mention of persons who have their dead to be buried. I want him to address us too. But we are working with it.
Yes, to me it's okay. And it should have started from Friday. All day Friday, all day Saturday, all day Sunday. For the people in here and I understand.
Yeah, you have to have a stoppage to something, for we don't know what is the consequence of this thing. Saying that if we make a rule, we have to obey by the Prime Minister. So, I've nothing wrong about that.
Now, the parliamentary opposition is predicting that the new measures announced on Sunday by the Prime Minister will have little effect in curbing the surge in COVID-19 cases in the short term. Opposition spokesman on health Dr. Maurice Guy says the weekend lockdown is an inadequate response to the health crisis. He says the situation requires more stringent, immediate action.
If you think about the dynamics of the spread of COVID-19, the effect of that lockdown will not be manifest until 2 weeks after the start of it. So we are in a situation right now where we have spiraling numbers, we have overcrowded hospital facilities, we have people lying on the floor in hospitals, we have shortage of oxygen, and the Prime Minister has not done anything or said anything that will arrest the situation now.
Dr. Guy also criticized the Prime Minister for not addressing the overcrowding at hospitals and the shortage of medical oxygen.
I'm also dissatisfied with the fact that the Prime Minister has not mentioned what is the new public health strategy. What is it that is going to be what is the increased testing that is required to arrest this? What is the point of care testing? Where is the antigen testing that ought to be done at each of the government facilities, whether it's health centers or hospitals, as patient comes in, so you have a handle on the infection right there and then.
Despite bed shortages, the number of people in hospital with COVID-19 reached a new record 418 on Sunday. 37 of those in hospital battling the disease are in critical condition. At the same time, the country recorded 3 new deaths from COVID. The number of COVID-19 deaths now stands at 536. 2 females from St. Catherine, one 46 and the other 33, and a 77-year-old male from Westmoreland are the latest to die from the disease. Meanwhile, Jamaica also recorded 558 new COVID-19 cases on Sunday. This pushes the number of confirmed cases to 35,896. Kingston and St. Andrew recorded most of the new cases with 219, followed by St. Catherine with 177. There are 18,801 currently active cases. And it's now time for a break here on the Midday News, but please stay with us. We'll have much more when we return. Welcome back. We're continuing the news. 3 men were taken into custody in St. Elizabeth last night after they were found with house-breaking tools. According to the police, acting on information about a planned robbery in the Santa Cruz shopping area, they carried out a spot check on Main Street. Around 9:30 p.m., a Toyota Voxy fitting the description of the getaway car was seen and stopped. The driver obeyed and a search was conducted, where a steel cutter was found hidden in the bonnet of the vehicle. 3 male occupants were taken into custody for being in possession of house-breaking tools and a breach of the Disaster Risk Management Act. Senator Cavan Gale is expressing dissatisfaction with the level of protection offered to children under the Sexual Offences Act. The lawmaker raised the matter during last week's sitting of the Joint Select Committee reviewing the Sexual Offences Act.
And I'm of the profound view that in this case, sexual harassing a minor must be treated even stronger than what is contained here. And I'm not sure if the other legislations in terms of the Sexual Offences Act would treat with those, but it shouldn't be the same reporting and going to a tribunal if a minor is being exposed to sexual harassment anywhere, in any shape or in any form.
To other news, Environment and Climate Change Minister Pernell Charles Jr. is defending the government's environmental goals, in particular the tree planting and replacement targets. He said the program to plant 3 million trees in the next few years is not too ambitious, nor is it a project that will be given just lip service. He addressed the matter during an exercise to mark International Day of Forests, which was celebrated yesterday, Sunday, March 21. Several trees were planted on the grounds of the Rio Cobra Juvenile Center in recognition of the International Day of Forests. Young men housed at the correctional facility participated in the exercise. In news overseas, an interesting development out of Cuba on Sunday, as the government announced it is planning to team up with China to develop a new vaccine designed to combat emerging strains of COVID-19. More from the CNN.
The Cuban and Chinese governments will collaborate on a new vaccine designed to combat emerging strains of the coronavirus, Cuban scientists announced on Sunday. This is the first time that we are aware of that these two communist governments have collaborated on a vaccine. Cuba currently has 5 other vaccine candidates in the works. It is the only Latin American country to have vaccine candidates advance to the final stage 3 trials. Cuba has not vaccinated widely among its population as of now, but they say that they will have produced enough vaccine for this island by August and should have the entire population of Cuba vaccinated by the end of the year. One of those vaccine candidates, Soberana 2, was developed working with the government of Iran, and Cuban scientists said over the weekend that starting on Monday, they expect to expand trials of that vaccine, Soberana 2, to 150,000 people in the capital city of Havana.
To news in sports, 2 members of the Reggae Boys delegation which travelled to Austria ahead of Thursday's friendly international against the United States have tested positive for COVID-19. The persons with the positive test comprise a player and a member of the technical staff. It's understood that all members of the delegation who arrived in the European country today have been in isolation. Everyone is expected to undergo further COVID-19 PCR tests today prior to the team being allowed to conduct a full training session. And news in cricket, it's been slow going for the West Indies batsmen so far on day 2 of their first test against Sri Lanka, as the Caribbean men are now at sports time. They are on 102 for 3. Now Jamaican Jermaine Blackwood is at the crease. He is on 0. He just went to the crease, and I'm looking at the updates live here on my phone. Kyle Myers is also not out on 16. The hosts who resumed the day on 13 without loss lost captain Craig Brathwaite, who failed to add to his overnight 3. Jamaican Nkrumah Bonner is the other wicket to go, having made 31. The Windies trail the Sri Lankans by 67 runs at the moment after dismissing Sri Lanka for 169 on Sunday's opening day. Now, just to remind you, the West Indies are 102 for 3. Now, they are replying to Sri Lanka's 169 all out, this on day 2 of the first test. And that's the Midday News. I'm Giovanni Dennis. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, have a good afternoon.